This is my final capstone presentation, and it is on ADHD. ADHD is a neurodevelopmental disorder. Neurodevelopmental disorders are a group of disorders that begin in childhood, and they impact the development and function of the brain. Symptoms of attention deficit hyperactivity disorder / ADHD include inattention, hyperactivity, and impulsivity. The signs of ADHD include daydreaming a lot, forgetting or losing things, squirming, talking too much, making careless mistakes, having a hard time resisting temptation, having trouble taking turns, and difficulty getting along with others. ADHD symptoms can present as mostly inattentive, mostly hyperactive, impulsive, or a combination of the symptoms between the two other categories. The predominantly inattentive presentation involves having trouble organizing or finishing a task, trouble paying attention to details, or trouble following instructions. In this presentation, the individual is easily distracted or forgets routine daily details. In the predominantly hyperactive impulsive presentation, the individual may fidget a lot, talk a lot, feel restless, or be impulsive. The combined presentation has symptoms of the other two types. To get diagnosed with ADHD, the DSM-5 states that ADHD symptoms have to last longer than 6 months, be seen in 2 settings, and negatively impact social, occupational, or academic functioning. There is more criteria to getting diagnosed with ADHD, including conditions that have to be met and the number of symptoms required. So for children up to 16, they need 6 or more symptoms, and for adolescents and adults, they need 5 or more symptoms. ADHD impacts a lot of the brain, including the frontal cortex, subcortical regions, amygdala, right middle temporal gyrus, frontostriatothalamic circuit, which has reciprocal connections between the caudate, putamen, supplementary motor area, thalamus, lateral prefrontal cortex, and the parietal lobe. Also impacted is the frontostriatal circuit, which involves the nucleus accumbens and orbital frontal cortex, and the prefrontal cortex and inferior parietal lobe are impacted by ADHD. Neuroimaging studies have given conflicting evidence about the brain structures involved in ADHD. However, the National Institutes of Health notes that researchers have found that youth who experience ADHD have elevated brain activity that connects the frontal cortex and subcortical regions. Also, the brains of youth with ADHD showed greater connections between the frontal cortex and the amygdala. Also, another researcher found that youths that have ADHD had greater connectivity between the striatal seeds and temporal, frontoinsular, and supplementary motor regions. It was found that youths with ADHD had greater connectivity between the amygdala and the dorsal anterior cingulate cortex. Another researcher found volumetric reductions in the right middle temporal gyrus in children with ADHD. Another researcher noted that in the literature, it has found that children that have ADHD have lower cortical thickness, especially in the prefrontal cortex. In those with ADHD, it was also found that they had decreased neural flexibility in the default mode network, executive function-related networks, primary networks, and attention-related networks. There is a hypothesis that those with ADHD lack dopamine, and this is based on the fact that stimulant drugs, which are often used as a treatment for ADHD, target monoamine systems, which include dopamine, and also that animal models altered for dopamine homeostasis mimic some ADHD symptoms. Also, this hypothesis is supported by brain imaging studies that implicate the dopamine system. However, there are some skeptics about this theory. The frontal cortex plays a role in the control of unwanted behaviors and in attention. So this would relate to symptoms of impulsivity and inattention in those with ADHD. The subcortical regions are involved in learning, emotion, movement, and reward, and the function of this region would relate to impulsivity and hyperactive symptoms like trouble waiting on their turn and fidgeting. The amygdala plays a role in processing emotions. This would relate to the emotional symptoms of ADHD like irritability, being overly excited, and or having a short fuse. White matter connections in the right middle temporal gyrus could be related to higher order cerebral networks like the default mode network. The default mode network plays a role in memory processing, emotional regulation, and self-referential cognition. This would relate to potential emotional dysregulation symptoms of ADHD and of losing items necessary for tasks. The frontostriatothalamic circuit comprises connections between many parts of the brain, and this altogether relates to executive functions like working memory and inhibitory control. So this would relate to issues with instruction and symptoms like interrupting others. The frontostriatal circuit involving the nucleus accumbens and orbital frontal cortex relates to deficits in delaying gratification, effort-related decision-making, and reinforcement sensitivity. This would relate to symptoms like issues waiting for their turn or blurting out answers. The prefrontal cortex is related to cognitive control and executive function, so it plays a role in decision-making, planning, and emotional regulation. So regarding symptoms, this would play a role in issues related to organizing tasks, following through on instructions, and emotional dysregulation symptoms that those with ADHD may experience. Studies have indicated that the inferior parietal lobe has a lower activation for visuospatial attention in children who have ADHD, so this would relate to the potential symptom of losing items necessary for daily tasks. Neuroplasticity contributes to developmental outcomes in that adaptive neuroplasticity is a mechanism of healthy brain development and maintenance. Some authors note that management of ADHD can happen with interventions that stimulate adaptive neuroplasticity. Neuroplasticity is a mechanism of the brain to reorganize itself and is a cause or trait of successful neuropsychiatric treatments. So plasticity is a factor in early interventions for children in disadvantaged environments and for children at an elevated likelihood for neurodevelopmental disorders. An example of using plasticity to improve outcomes is with physical activity. An author notes that physical activity promotes neuroplasticity in those with ADHD. Physical activity leads to neurostructural changes and neurofunctional changes in the brain, especially those related to executive functioning, and this promotes neuroplasticity and helps improve neurocircuit efficiency related to cognitive and behavioral regulation. Also, physical exercise contributes to the prefrontal cortex maturing, and this is a region important for attention regulation and executive functioning. Exercise-induced neuroplasticity enhances cognitive flexibility, impulse control, and motor coordination. Exercise may also enhance neurotransmitters like dopamine and norepinephrine. Another author found that there was insufficient involvement of the inferior parietal lobe in children with ADHD. The author found that enhancement of the functional connectivity of the inferior parietal lobe and inferior frontal gyrus as a potential compensatory functional brain activity reorganization modulated by visual spatial attention's cognitive demand. Brain imaging studies for ADHD have not always had consistent findings, with potential for measurement bias in MRI scanners. Having a more complete understanding of the ADHD brain would help optimize treatment strategies. A potential way to improve the brain imaging studies would be to include artificial intelligence. Authors have noted that deep learning techniques have allowed for state-of-the-art results in image formation and image analysis, protocol planning, and pathology detection, so this could be applied to brain imaging studies related to ADHD. Also, it is noted that artificial intelligence could be applied to automated tasks, like interpreting scores for neuropsychological tests. As such, a benefit of using ChatGPT in healthcare is its ability to analyze large data sets and gain insights from them, so this could be applied to studies. However, it is noted that ChatGPT does have limitations when it comes to neuropsychological assessment, though it does still have a potential to be useful. ChatGPT lacks the ability to have a therapeutic alliance, emotional intelligence, and empathy. It may not grasp language nuances, which could lead to errors and misinterpretations. Also, there are limitations to privacy, like the fact that there is not foolproof assurances that data will not be breached or misused. Stimulants like methylphenidate and amphetamines are used to help improve symptoms of ADHD. These stimulants work by blocking dopamine and norepinephrine transport, inhibiting catecholamine reuptake in dopaminergic nerve terminals. Stimulants have effects on ADHD symptoms, particularly by optimizing dopamine and norepinephrine modulated task-related networks that increase perceived saliency. Also, stimulants enhance task-related brain networks and suppress the default mode network. Stimulants increase the availability of norepinephrine in the prefrontal cortex, which leads to reduced symptoms and improvement in executive functioning. However, the Centers for Disease Control and Prevention states that for children who are younger than 6 years old, behavioral management therapy should be tried before ADHD medication is used. Behavioral therapy is an effective treatment for ADHD, and it is evidence-based. For young children, behavioral therapy is most effective when it is delivered by parents. So it is recommended that healthcare providers refer the parents of children who are younger than 12 years old for behavioral therapy training. The parents or guardians would learn skills and strategies to help the child. Stimulus control techniques and contingency management techniques are used in this type of therapy and are commonly taught to parents. Stimulus control techniques can be used to manipulate antecedents of behavior by providing clear instructions or restructuring the child's environment. Contingency management techniques are used to manipulate behavioral consequences, which involves ignoring undesired behaviors and complementing desired behaviors. Within parent training, the parents or guardians would attend 8 or more sessions, which involves working with other parents or one family. The therapist would meet with the parents to review progress, support the parents, and adjust strategies. The parents practice with their children between sessions with the therapist. A group of researchers found that aerobic exercise enhances sustained attention, coordinated activities help with cognitive flexibility, and high-intensity training improves impulse control. Researchers found that physical exercise can improve attention, executive function, and motor skills in children who have ADHD. It is noted that studies indicate physical exercise can improve dopamine regulation, prefrontal cortex activity, and neuroplasticity. Exercise leads to increased central arousal related to increased release of frontostriatal neurotransmitters like dopamine, norepinephrine, epinephrine, and serotonin. Exercise may compensate for dysregulated catecholamine levels and improve cognitive and behavioral functioning. Physical activity can be used as a complementary intervention to behavioral therapy and psychopharmacology due to its impacts on emotional regulation and executive function. The concept of neuroplasticity, which was reinforced within this class, helped to inform my analysis because I was able to apply this concept to potential ADHD treatments. This concept allowed my analysis to then be more well-rounded than it would have been. The concept of neuroanatomy helped inform the section about the parts of the brain impacted by ADHD. By understanding neuroanatomy, I was able to look at ADHD from a neuropsychological viewpoint. The concept of neurotransmitters was involved in the psychopharmacological treatments and potential impacts of ADHD on the brain. What I learned about AI ethics from this course was applied to the potential of using AI for clinical applications related to ADHD. So in total, learning all of these concepts allowed me to complete this assignment in a well-rounded way and complete the assignment knowing all the knowledge necessary for the topic. To complete this assignment, I expanded the outline from activity 6.2 so I would know what I needed to discuss within this recording. Then I designed the presentation, making sure the background and the font colors were contrasting enough that it was easily readable. I added phrases from the outline and I modified those to fit within the PowerPoint formatting. Then I found images to add to the slides that were empty, needed filling out. Then I recorded the audio, and after the audio is recorded, I will read through the PowerPoint to make sure there's no mistakes within it. The next two slides are the references that I used throughout the presentation. They will also be included in a Word document. Within these references, there are the sources for the images included within the presentation.